So what should cancer patient ask his or her doctor?
Okay, so if you've gotten to a stage where you're diagnosed with cancer and you now see an oncologist, a cancer doctor, you need to be sure whether this person has your best interest at heart. Because I'll say today that oncologists are by and large sociopaths. Sociopaths meaning that they intentionally give patients treatments that are harmful to them.
Why?
Well,
just contradicts
it is contradictory, but this is what is happening. It is a well-known fact that radiotherapy or chemotherapy are things that harms the patient. And if you knowingly give this to a patient, you're a sociopath. You're doing something that is not right for the patient, but you're giving the person anyway. So what you should ask the patient, what you should ask your doctor is several things. And these are some of the questions you should ask. If I don't go on this treatment, what is my lifespan? So, for instance, if he says, "Oh well, you're having if you go on this treatment, you might extend your lifespan for a year," then you then ask the question, "Okay, if I don't go on this treatment, how long will I live? Will it be 6 months? Will it be 9 months?" So that's a question you should ask. Another question you should ask is, if I go on this treatment, what is the quality of life? Because you might say to yourself, okay, I might be extending my life, but if I'm in constant pain as a result of this treatment, would it be worth me taking this treatment or not? So the quality of life is very important. Another question you should ask is, by he or she, what is their cure rate of using this treatment on you? So they might say a 30% cure rate or a 40% cure rate or 10% cure rate. And then you might go as far as saying that you might want to get references for those who've had that treatment from this doctor and what has been their outcome. You might want to get references from the doctor. Another question you might want to ask is, this treatment that they are providing you, do they profit from it in any way? Now, this might be a very strange question, because it is being found, in my research at least, that in the United States, doctors there do profit from using chemotherapy. Cancer doctors do buy their chemotherapy wholesale and provide it for patients. They profit from it. And that is a massive conflict of interest, because you might profit from something that does your patient harm, but you provide it anyway because you're making money from it. So that's a question you might ask. In the UK...
this question, even if they do, they will never answer this.
They should answer. No, they should be able to answer. It's a question you should ask. Because this is the person who you're basically putting your life in their hands. And you need to ask these questions. I know some of these questions might be difficult to ask, but it's a question that is a life and death situation that you need to find out. One more question regarding the treatments that you might be provided with by your oncologist is, do they have children? And if they do have children, would they, if their children had that same cancer, would they provide that treatment to their own children? Now, in asking this question, you would need to look at their body language and see what the response is. And whatever they tell you and you feel from their body language, you'll ask yourself, do you want to go down that route? And lastly is, whilst on that program, would they recommend what you should eat or what you shouldn't eat? Now, this is a big one, because if they say, oh, basically you could eat anything you want, have as much, cakes and gelatos and sweets as you can have, that should be worrying. Because one of the things that we do know that is unquestionable about cancer is that cancer is attracted to sugar.
I don't think any doctor would say eat as much sugar as you want, eat burgers, eat processed foods. Even NHS, GPs tells you, like, eat healthy, exercise. I don't think they will say that.
Some cancer doctors would say that because they'll say you need to have a lot of calorie intake, because one of the side effects of having cancer is that you do lose a lot of weight. That's due to cachexia. And so they will say you need to increase your caloric intake. So how do you increase your caloric intake? You need to eat a wide range of foods. That is actually the wrong advice, because what you should do, one of the things you should actually stay away from is anything to do with sugar or anything to do with simple carbohydrates, because this is what feeds cancer cells. Cancer cells takes in a lot of glucose. It's the way it metabolizes its energy. It doesn't metabolize its energy from oxygen. It metabolizes its energy from glucose, and it consumes, I think it's between 15 and 8 times as much glucose as non-cancer cells. So a cancer doctor that says, basically eat what whatever you can or whatever you like, that is worrying. And I think you need to think twice if you're going to go with such a doctor.
And what about genetics? I know you think that genetics is not the cause of the cancer.
I think is misleading people or confusing people is the difference between genetics and predisposition. So for instance, you're most likely to get illnesses similar to that of your parents because of what your parents have passed on to you, while giving birth to you, but not genes. So for instance, if your parents doesn't eat enough of a certain nutrient, you're likely not to have that nutrient in your body when they give birth to you. And so you might be predisposed to certain illnesses as a result of not having that nutrient. That is not genetics. Another thing as well is that we all have habits that we, good or bad, that we copy from our parents. We are exposed to the same thing because we're living in the same type of environment. We drink the same type of water. We have the same good or bad habits. So some of the things that our parents had, as a disease, we might likely suffer from them. Is because we're living within the same environment, the same lifestyle. That's not genetics.
But we don't inherit this with the genes.
That's what I'm saying, that at least, at most 5% of cancer is apportioned to genetics. And if you look at it quite closely, if you look at the statistics, we're being told that currently it's 1 in 2 people will suffer from cancer. But at the turn of the century, it was 1 in 20. At the turn of the 20th century, it was 1 in 20. So if it was genetics, then it would be a straight line. The graph wouldn't be, this high. It would be a straight line because it's all going to be the same people with the same genetic input that would have cancer.
So you say if my mom had cancer, she died from cancer, it's only 5%, the chances are only 5% that I will have a cancer as well. But if I live very different lifestyle from her, healthy, then I reduce my chances, right?
Yes, and in fact, there's something called epigenetics, the study of how your genes can be changed. So even if it's all genetics, genes are not they're not inchangeable. Your genes can be changed.
Really?
Yes. Parts of your genes can be changed, like the color of your eyes, the color of your hair, your skin complexion. That's fixed, but there are parts of your genes can be changed. So that's what I'm saying. That there's a study called epigenetics, how genes can be changed, and it can be changed through the improvements of your mind. The power of your mind can change the way your gene expresses itself.
Is it proved?
It's proved. There's a book called the Biology of Belief, and it's written by Bruce Lipton, and he has done numerous studies on the matter, including him with other scientists as well.
Does conventional medicine accept it?
No, because as I said, many of these modalities don't. They're not money making Conventional medicine is more to do with money making to the industries that is involved in it. So it's being kept. Most of these things about mind-body connection, nutrition, biochemistry is kept out of the public domain. It's not being spoken about. And the reason being is that because these three therapies, the chemotherapy, radiotherapy, and surgery, are the things that makes the most amount of money for these companies, these industries, that is all that is being spoken about.